Hey friends! In today's video, we're going to talk about neurodevelopmental disorders. So the first disorder we're going to discuss is autism spectrum disorder. This is a neurodevelopmental disorder that affects how individuals interact with and perceive the world around them. It's characterized by difficulties with social communication and interaction, as well as repetitive behaviors and restricted interests. According to the DSM-5, the diagnostic criteria for autism spectrum disorder include 1. Deficits in social and emotional reciprocity, such as difficulty initiating or responding to social interactions. 2. Deficits in nonverbal communicative behaviors used for social interaction, such as eye gaze, facial expression, and body language. 3. Deficits in developing, maintaining, and understanding relationships, such as difficulties adjusting to change in routines or difficulties in sharing interests and emotions. 4. Restrictive, repetitive behaviors, interests, or activities, such as repetitive movements or strict adherence to routines. Autism spectrum disorder can be assessed through a variety of tools, including the Autism Diagnostic Observation Schedule and the Autism Diagnostic Interview Revised. These tools involve structured observations and interviews with individuals, as well as parents or caregivers, to assess the presence of autism spectrum disorder symptoms. Treatments for autism spectrum disorder typically involve a combination of pharmacologic and non-pharmacological interventions. Pharmacologic therapies may include medications to address co-occurring conditions such as anxiety, depression, or attentive deficit hyperactivity disorder. Non-pharmacologic treatments may include behavioral interventions such as applied behavioral analyst or speech therapy to address the individual's specific needs and improve their ability to communicate and interact with others. Some interesting facts about autism spectrum disorder include autism spectrum disorder affects individuals of all racial, ethnic, and socioeconomic backgrounds. Boys are more likely to be diagnosed with autism spectrum disorder than girls. Early intervention is crucial for improving outcomes for individuals with autism spectrum disorder. Many individuals with autism have exceptional abilities in certain areas, such as music or art. The next diagnosis we're going to talk about is called Attention Deficit Hyperactivity Disorder, or ADHD. It's a neurodevelopmental disorder that's characterized by inattention, impulsivity, and hyperactivity. These symptoms can interfere with an individual's ability to function at home, at school, or in social situations. According to the DSM-5, the diagnostic criteria for ADHD includes 1. Inattention, such as difficulty sustaining attention or following through on tasks. 2. Hyperactivity and impulsivity, such as difficulty sitting still or awaiting one's turn. 3. Symptoms that are present in 2 or more settings, example at home and at school. 4. Symptoms that cause impairment in social, academic, or occupational functioning. ADHD can be assessed through a variety of tools, including the Conners 3 ADHD Index and the Vanderbilt ADHD Diagnostic Parent Rating Scale. These tools involve structured interviews with the individual as well as with parents or caregivers to assess for the presence of ADHD symptoms. Treatments for ADHD typically involve a combination of pharmacologic and non-pharmacological interventions. Pharmacological treatments may include medications such as stimulants or non-stimulants to address the individual's symptoms. Non-pharmacological treatments may include behavioral interventions such as parenting skills training or cognitive behavioral therapy to help the individual learn strategies for managing their symptoms and improving their functioning. Some interesting facts about AD includes AD affects individuals of all racial, ethnic, and socioeconomic backgrounds. Boys are more likely to be diagnosed with AD than girls, and there is no cure for ADHD, but symptoms can be managed with treatment. Many successful individuals have ADHD, including entrepreneurs and celebrities. The next diagnoses we're going to talk about is communication disorders, which refers to a range of conditions that affect an individual's ability to comprehend and produce language. These disorders can affect an individual's ability to express themselves, understand others, and participate in social interactions. According to the DSM-5, the diagnostic criteria for communication disorders include 1. Deficits in receptive or expressive language, such as difficulty understanding or producing speech. 2. Deficits in social communication, such as difficulty initiating or maintaining conversation. 3. Deficits in pragmatic language, such as difficulty understanding nonverbal cues or using language in appropriate social situations. Communication disorders can be assessed through a variety of tools, including standardized tests, language samples, and observation of the individual's communication skills. These tools can help to identify the specific ways or difficulty and determine the most appropriate interventions. Treatment for communication disorders typically involves a combination of pharmacologic and non-pharmacological interventions. Pharmacological treatments may include medications to address underlying conditions such as attention deficit hyperactivity disorder or autism spectrum disorder. Non-pharmacological treatments may include speech therapy or augmentation and alternative communication to help individuals improve their language skills and communicate more effectively. Some interesting facts about communication disorders include communication disorders can affect individuals of all ages, from infants to older adults. They can be caused by a variety of factors, including hearing loss, cognitive impairments, or neurological conditions. Early intervention is crucial for improving outcomes for individuals with communication disorders. Many individuals with communication disorders can learn to communicate effectively with the right support and treatment. The next neurodevelopmental diagnoses we're going to talk about is intellectual disability, also known as intellectual developmental disorder, or IDD. It's a neurodevelopmental disorder that's characterized by significant limitations in cognitive functioning and adaptive behavior. This disorder can affect individuals of any age and be caused by a wide variety of factors, including genetic abnormalities, prenatal exposure to toxins, and complications during birth. According to the DSM-5, the diagnostic criteria for intellectual disabilities includes 1. Deficits in intellectual functioning, such as reasoning, problem solving, and abstract thinking, that are below average for the individual's age and developmental level. 2. Deficits in adaptive behaviors such as communication, social skills, and personal care that are below average for the individual's age and developmental level. And 3. The onset of these deficits happen before the age of 18. To assess for an intellectual disability, healthcare providers may use a variety of tools, including intelligence tests, adaptive behavior scales, and interviews with the individual and their caregiver. Pharmacological treatments for intellectual disabilities may include medications to manage co-occurring conditions such as ADHD or anxiety, as well as medications to improve cognitive functioning. However, there is no cure for intellectual disability, and treatment is typically focused on supporting the individual and helping them to achieve their full potential. Non-pharmacological treatments for intellectual disability may include therapy, education, and vocational training to help individuals develop skills and independence. The interventions can be tailored to the individual's specific needs and abilities and may include activities such as speech therapy, occupational therapy, and social skill training. One interesting fact about intellectual disabilities is that it's one of the oldest known developmental disorders with records dating back to ancient times. Another interesting fact is that individuals with intellectual disabilities can have a wide range of abilities and skills and can live a fulfilling and meaningful lives with the right supports and accommodations. The next neurodevelopmental disorder we're going to discuss is motor disorders, also known as movement disorders. They're a group of neurological conditions that affect the ability to control movements. These disorders can range from mild to severe and can have a significant impact on an individual's quality of life. According to the DSM-5, the diagnostic criteria for motor disorders includes abnormalities in movement that are not due to another medical condition or substances. This can manifest as involuntary movements, slowed movements, or difficulty initiating movements. One common motor disorder is Parkinson's disease, which is characterized by tremors, stiffness, and difficulty with movement. Another example is dystonia, which is marked by involuntary muscle contractions that cause abnormal postures or movements. Essential tremors is another type of motor disorder that is characterized by shaking or trembling of the hands, arms, or head. To assess for motor disorders, healthcare professionals may use a combination of physical exams, imaging tests, and laboratory tests. In addition, specialized assessment tools such as Unified Parkinson's Disease Rating Scale or the Tremor Rating Scale can be used to evaluate the severity of the disorder and monitor treatment effectiveness. Treatment for motor disorders may include pharmacologic and non-pharmacologic approaches. Pharmacologic treatments often involve medications that can help control the symptoms of the disorder, such as levodopa for Parkinson's disease or botulism toxin injection, also known as Botox, for dystonia. Non-pharmacological treatments may include physical therapy, occupational therapy, and surgical interventions. It's important for individuals with motor disorders to work closely with their healthcare team to develop an effective treatment. In addition, support from friends and family can be crucial for managing challenges of living with a motor disorder. Some interesting facts about motor disorders include motor disorders can affect people of all ages, though some types are more common in older adults. The causes of motor disorders can vary, but often involve changes in the brain or nervous system. In some cases, the exact cause of a motor disorder may not be known. Researchers are working on ways to develop new treatments and therapies for motor disorders. So in conclusion, motor disorders are a group of neurological conditions that affect movement and control. They can range from mild to severe and can have a significant impact on an individual's quality of life. Treatment for motor disorders may include pharmacological and non-pharmacological approaches, and support from healthcare professionals and loved ones is important for managing the disorder. So I hope you enjoyed this video on neurodevelopmental disorders, and I'll see you guys next time.